And then how do you within the healthcare system itself get cost savings? Something that the president's plan, if there is one, and the president seemed woefully unfamiliar with his plan in the last 2 days. But if there is a president's plan, everybody agrees it saves no money. So what would we do within the system to save money? We would first of all look at medical liability reform. We'd look at more health IT, more health information technology, and we'd look at more transparency. What do people charge and what kind of results do they get? None of those things are in the plan that the Democrats are offering, if there is a plan. There are about 3 different bills out there in the House right now, but every time you see the bill, it's 100 pages bigger than it was the last time you saw it. And if anybody here believes that there is a bill that any single Democrat knows what's in it, we'll have a debate on that, because I'm sure that's not true. And again, if you watch the president the last 2 days, as he was asked questions about his plan, he clearly didn't have answers about his plan. Our plan, more competition, more choice, let market forces work in a way that drive prices down. Don't defend the current system, but make the current system work better for consumers, and then also make the current system work better at the point of health care itself. Those 2 big principles over and over again are reiterated in the take a chance with my back here, in the 17 boxes of amendments sitting in the Commerce Committee waiting to be offered if they'll ever have a hearing. You can't offer your ideas if there's not a forum, a legislative forum to offer your ideas. You also can't combat their ideas if they change by 100 pages every time you walk into the room. And so we're eager to have this discussion. We have been right up to the edge of pounding on the door for 6 months. Now, our pounding on the door has been calling the White House Chief of Staff, talking to the President, sending letters saying we want to work with you on this. We want to make the current system better, and no one's responding to that. And obviously, they're not responding because they don't have an idea that meets any standard that meets the goals that we ought to be working toward in health care. And of our committee, the member that over the last decade really has been more engaged in this than anybody else day in and day out, been an integral part of the Solutions Working Group as well, is the ranking member on the Health Care Subcommittee, Nathan Deal.
Thank you, Roy. I'm Nathan Deal from Georgia. Let me put our circumstances in terms of schedule in perspective. Most of us believe that the decision as to major reform of how Americans get their health care in this country deserves at least as much time and deliberation as it would take to select a puppy to reside in the White House. It took the President 6 months to decide how long and which puppy he was going to have, and to expect Congress to do something on major health care reform in 6 days is totally irresponsible. Now, let me talk about a couple of areas that we are concerned about. As you've heard Roy Blunt say, we believe that the current system needs some reform. We believe that the current free enterprise system of delivering health care through private insurance companies has some things that need to be fixed. For example, we believe that exclusions for pre-existing conditions must be addressed, that the portability of insurance must be involved in any plan that is adopted, because people shouldn't have to worry about losing their health insurance just because they might lose their job. We believe that people should not have to worry about having their health insurance denied at a point in time when they file a claim simply because somebody in the insurance company goes back through their original application and decides they didn't put everything down exactly right. We believe that those are the kinds of substantive reforms coupled with the transparency issue that Mr. Barton referred to earlier. But let me mention another area, and that is the area of illegal immigrants being a part of a publicly financed health system. We've been through this debate before. We have a number of amendments that would assure the taxpayers of this country that they are not going to be using their hard-earned tax dollars to pay for people who are illegally in this country. Those are things that I think resonate with my constituents and certainly with most people across this country. I'm afraid we're not going to have the opportunity to offer those kinds of, I think, progressive reforms, not only to the current system, but also to the proposal that the Democrats have on the table.
I'm Cliff Stearns from North Central Florida. Let me echo what Mr. Blunt and Mr. Deal has indicated. The President has not read the bill himself. I'm going to have a very simple amendment, and let me just read it to you. Nothing in this division shall prevent or limit individuals from keeping their current health benefit plan. That sounds pretty simple, doesn't it? In fact, the President has said publicly, this is what he said, if you like your doctor, you will be able to keep your doctor. If you like your health care plan, you'll be able to keep that health care plan, period. So that's the President's statement. You saw my amendment. Now, what does the bill say? And I have a copy here for anyone who's interested. On page 17, it says after 5 years, the Commissioner and the Commission with the exchange mandates that all health care plans in America must meet a qualified health benefit plan under Section 101, including the essential benefits package requirement under Section 121. What that means is that all the plans that patients have will have to conform and be mandated to change, or they're eliminated, terminated. So the President says he wants everybody to be able to have their own choice of doctor and health care plan. They won't have the right to choose. Simply put, on page 17 of this bill, it outlines specifically after 5 years, all plans will be mandated to comply to the government health care position or be eliminated or terminated. So possibly the President needs to talk to Mr. Waxman, or possibly the President needs to revise this page 17, because what he says does not comply, and unfortunately I don't think he's read this section.
Marcia Blackburn.
We do want people to know what is in this bill, and that is the reason for bringing all of our amendments to you today, so that you will see what we're offering for the committee to consider. We certainly want to make certain that health care works for Americans. And this morning we had a great press conference with some female business owners that came to Capitol Hill to express their concerns. I'll cap just a couple of those for you. Are they concerned about cost? Absolutely, because they know that costs need to be addressed. Are they concerned about accountability for insurance companies? Yes, they are. And they agree with us, as you have heard Ranking Member Deal mention this morning, that some of those issues of portability with insurance, some of those issues of accountability do need to be addressed, pre-existing conditions. And we have amendments that would do that. And we're looking forward to the opportunity to present them not only to the committee, but to Congress and to the American people. And we certainly want to make certain that people have transparency in the options that are there, that people own their health insurance, that they own their health records. These are some of the highlights from the conference we had this morning with the female business owners. They are going to work hard with us as we continue to push through the next few weeks to look at what happens here before we go out on recess, to look at the opportunities that exist in August as we talk to constituents and as we talk to business owners, big and small, and as we talk to health care consumers, to make certain they understand our commitment to stand with them to preserve their access to affordable health care in their own communities.
Thank you, Ranking Member Barton. My name is John Sheddick. I'm from the 3rd District of Arizona, and healthcare reform has been a passion of mine since I got here. I worked on Patients' Bill of Rights reforms with Tom Coburn in the House clear back in 1995, 1996, 1997. I have written a comprehensive healthcare reform bill every year I've been here. I have written legislation to enable people to buy health insurance across state lines so they could get it at an affordable rate. Let me make it clear there are things we agree upon, and you've heard them here, but I want to make sure you understand them. Republicans believe in and support legislation to fix the problem for people with pre-existing conditions and chronic conditions. We believe that those people ought to be able to buy health care through a high-risk pooling mechanism or a reinsurance program at the same cost as every single one of us. Every one of them should, and this isn't just talk. We passed legislation to encourage states to do that through state high-risk pooling mechanisms at least 4 years ago. I know because I wrote the bill. So there's agreement on that issue. If we Republicans would like to go further now and make that a national high-risk pool so it covers everybody.